Hi, my name is Damandeep Kaur. I'm a corporate lawyer. I'm here with my husband Parvinder Singh. We've been married for about 5 years. We are a love marriage. We've been trying since the very first year of our marriage, and we met a couple of doctors to figure out why I was not getting pregnant. It had been 4 years, nothing was happening. Then one of our very close friends, my husband's best friends, had gone through the IVF treatment, and it was a success for them. So they recommended to us that why don't we go to the doctor, who was Dr. Tanya, and try that out if nothing was working out.
First time we came to Max to meet Dr. Tanya, we talked to her, we had a consult with her for about an hour and a half, which was a first because usually doctors don't give you time. She sat with us, she explained everything to us, what were the possibilities, why we were in the position that we were in, and what we could do henceforth to try and conceive, which was very, very important for us.
Once we started our host of investigations and I started scanning Daman and doing the semen analysis for Parminder, we found out that Daman, due to her past history of tuberculosis of the intestine, which she had as a young girl, had actually had a devastating effect on her insides. In the past, Daman had had 3 surgeries, an intestinal surgery because of tuberculosis, and she had cuts, one midway, one sideways, and one horizontally on her tummy. Her uterus, which is her womb, was badly stuck with the tubes, which is the little tube which connects the uterus to where the ovary picks up the egg. When we further continued our testing, we found out that Daman's tubes were actually dilated and swollen with the dirty fluid, a condition that we call hydrosalpinx.
So the whole procedure was explained very well in a lot of detail by Dr. Tanya, and that actually gave us a lot of comfort to go for the laparoscopy process, because what was explained to me was that once my tubes are clipped, I could never get pregnant naturally, and that was a very big thing. But the comfort that I got from Dr. Tanya was that doesn't mean that I cannot get pregnant at all, and during the IVF, through the IVF process, that's possible.
Parminder, his sperm tests initially, which were done about a year ago, were normal. But to our surprise, when we repeated it at our unit here in Panchsheel, his sperm count was very low. So when we talk of a low count, normal range being about 15 million, his count was less than 2 million.
We followed a regime of medicines, as well as there was a pseudomonas infection which I had, which was resulting in the low sperm count. I went in for a injectable antibiotic course for almost 12 days.
So after the surgery, when we had decided to start the IVF process, my mom was going through a tough stage where she was terminally ill with cancer, and doctor had said she had only a few weeks to live. We had to decide between whether to start the process or wait. Then we had to take the tough decision of taking a break in between before we start the process. And at that time, my husband was very supportive about the whole thing, which also made me more strong. So after about a month, we decided that it's time that we have to move on, and we told Dr. Tanya that we would like to start the process.
Her egg pickup was very difficult because her left ovary was enveloped with the intestines because of the tuberculosis, and there was a possibility of doing the pickup of the eggs through the abdomen, which is only very rarely done. Most people in their entire career don't ever land doing an egg pickup through the abdominal route.
My family believes in astrology, so I was informed that that's not the right period to go through all the this process and to conceive. So I was a little jittery about the whole, looking at the results. So I had requested Dr. Tanya to see the results on our behalf.
Yes, we looked at the result, and yes, we had a fabulous beta HCG, which is a pregnancy test, being positive.
I really couldn't believe. I was overjoyed, and it was the stars and so-called astrologers were proven wrong.
I can tell you how she exclaimed and chuckled on the phone like a little child who gets his first toy. She was so excited, and from then on it was a beautiful journey. And today she has this most beautiful little girl, Mannat, who not only completes her family, is a mannat, is a dream, a desire for them, but a journey for me as well, and for all of us at Max IVF. Our dream for every couple is to give it our best and to have this beautiful baby in our arms, a lovely little desire which fulfills our family and makes us complete.